Hello everyone. Thank you for taking the time to listen to this presentation. The assignment for our class was to take an in-depth exploration to develop our understanding of core public health services and programs and apply our newly learned concepts of program planning, implementation, and public health infrastructure. To do this, I decided to explore a program that I have been working with along with many other incredible people for a bit over a year now. This program operates in British Columbia and is officially titled the Provincial Peer Network. The first thing I would like to do is contextualize the program's formal existence under the existing legislative structures. The creation of BC's Provincial Peer Network was mandated by the relatively newly established, in 2017, Ministry for Mental Health and Addictions under John Horgan's NDP provincial government in BC. Specifically, the program is stated by name in the MMHA's framework document titled A Pathway to Hope. This program was integrated into a 10-year plan for the, quote, mental wellness, improved mental health care, and establishment of an effective substance use prevention, addictions treatment, and recovery system. From a legislative standpoint, explicitly committing to creating a program like this is incredibly innovative. However, the community of people who use drugs had recognized the importance of this network and began to build it several years prior and were instrumental in lobbying for it to become a government priority. In reality, this network has been in existence since 2009, operating as an incorporated society called the BC Yukon Association of Drug War Survivors, or BCYADWS for short. This organization has hundreds of members and consists of over 12 hyper-local community drug user groups. They have their own constitution and mandate that govern the organization and network, which were collectively made by over 100 people who use drugs and allies at an annual general meeting. They have received the dedicated funding to operate the Provincial Peer Network. Comparing the mandates of the two entities, it is clear that the priorities are very similar, but they're not the same. The purpose of the program, as paraphrased from the MMHA's framework document, was to create a network of people with lived and living experience with substance use, provide funding and capacity building for organizations of people who use drugs, and to inform the provincial overdose response to save lives and better connect people to harm reduction services and recovery. I have shortened some of the principles for formatting, but the BCYADWS Constitution has 3 principles that are broadly aligned with these 3 mandates, namely, 1. Establish a social justice network for people who use drugs that encourages, supports, and welcomes people who use drugs and connects them to drug user networks across BC, Canada, and globally. 2. Improve the quality of life for people who use illicit drugs through capacity building, education, and learning opportunities about safer drug use and harm reduction. 3. Ensures the voices of people who use illicit drugs are strengthened and empowered so that concerns about social, medical, and economic issues can be heard by policymakers, service providers, and the public at large. These 3 principles go beyond the MMHA's Provincial Peer Network, but they do meet all the criteria. The BCYADWS Constitution also has 5 more guiding principles that clearly lay out the organization's purpose to build strong communities focused on health promotion, social justice, human rights, and respect. Contextualizing this program requires acknowledging that this organization does not moralize substance use, but aims to reduce the harms of the drug war. Perhaps most aptly, this can be summarized as a quote from the BCYADWS Executive Director, Erica Thompson, saying, "We change systems, not people." BCYADWS hosts most of its defining documents on its website, including its constitution, bylaws, annual general meeting minutes, funding applications, and more. The organization has 5 paid staff to manage projects. I'm grateful to be one of these people, and we collaboratively support the Provincial Peer Network. BCYADWS is effectively a provincial organization, though it does have membership to people who use drugs in the Yukon. We are a registered nonprofit society. The organization is democratically run. Their bylaws state in order to be a voting member of the society, you have to have lived or living experience with substance use, and they don't mean weed. They hold annual conferences and general meetings for their members to gather, take care of organizational business, and nominate their board of directors. This board of directors is made up of people with lived and living experience, and there is representation from all regions of health delivery in BC. They currently fund and support over 10 drug user groups in multiple communities of BC, and as announced in their 2019 AGM minutes, the organization has received $1 million to operate the provincial peer network in 2020, along with some other smaller pockets of funding. With the program introduced, we can begin the process of situating the program into one of the core public health service areas. The three possible service areas that it could fit into are emergency response, disease injury or disability prevention, or health improvement. In reality, it is a health promotion initiative that spans into three categories. Rationalizing this, the program is funded under the MMHA to assist in the response to BC's declared opioid overdose public health emergency. But this emergency is unconventional in that it is not resulting from a natural disaster or disease, but rather accidental injury and death. Therefore, in this situation, the two areas are intrinsically linked. However, the provincial peer network does not directly aim to stop overdose. In both the BCYDWS and MMHA priorities, it is a program to improve social and political conditions through building community and indirectly reduce substance-related harms, therefore responding to the opioid overdose emergency. For the purposes of this assignment, I'll be framing the provincial peer network as a health improvement program, because this is where the program's activities best fit, by taking on a key public health role of fostering friendships and social support networks in community. This situation creates a jurisdictional nightmare, which manifests itself as governments passing the issues to different bodies until you eventually close the loop. So from each perspective or core program, you paint a different picture of responsibility and jurisdiction. But since I'm framing it from a health improvement perspective, the responsibility falls most appropriately at the provincial level to the BC Ministry of Health, and also at the federal level to the Public Health Agency of Canada and Health Canada. As a side note, the provincial peer network consists of smaller drug user groups which largely fall under the jurisdiction of regional health authorities. Now that we are framed and explained what the true issue being addressed by this program is, that we have a population of people that is being systematically marginalized through flawed policy that continues to fuel the spread of HIV, hepatitis C, over-incarceration, homelessness, and overdose. There is an overwhelming need for community development in this population to build and support a social base, political influence, and self-determination. The target population are simply criminalized people who use drugs in BC and the Yukon. While the community development is inclusive of all people who use drugs, the populations at intersecting marginalized social positions are prioritized for support. At the end of the day, the Provincial Peer Network is best viewed as a program that builds community capacity through establishing and supporting community hubs known as drug user groups. The planning process is participatory in nature. It is most truly by community for community. Now we can move on to the impacts and outcomes. There are not currently any publicly available evaluations of the Provincial Peer Network since it's a relatively new program. Though considering that the project is aimed at addressing social determinants, measuring these social and political impacts is going to be difficult, especially since expected effects of community building are indirect. As an added challenge, harmful power dynamics can also be created when evaluators come in to evaluate the community. The most basic objective of the program is to establish drug user groups throughout the province. But drug user groups are more than just a group of drug users. This is why the organization has created a drug user group community development rubric. The grading areas focus on location, inclusiveness, fair governance, dispute resolution, fiscal responsibility, mentorship, information flow, and innovation. Groups are scored from 1 to 4 on each of these 13 points to gauge how they are developing. Similar evaluations have been conducted in the past, and they can also be applied to this project. When these are graphed out, they make a plot called a sociogram. There is a solid base of evidence built off of smaller projects of community drug user empowerment, particularly a group called the Vancouver Area Network of Drug Users, or VANDU. This evidence shows that VANDU contributed to many scientific research articles and projects, legalization of supervised consumption sites and other legislative changes, and increased effectiveness and availability of community engagement. Besides this, research shows that engaging the community in assessments and decision-making is a key principle of evidence-based public health. Learning from other community-based empowerment projects such as the Black Panther Party's public health initiatives and the Common Ground Collective formed in post-Katrina New Orleans, we know that community can be more capable than the state or large NGOs at addressing public health emergencies. And to drive this point home, basic community capacity is required for almost all participatory approaches to public health interventions. The Provincial Peer Network has strengths and weaknesses. Some of the weaknesses are that legislative and organizational mandates are not completely aligned, which could lead to potential future conflicts. The group is forced to maintain positive relationships with oppressors in order to maintain funding, potentially hampering the community from speaking truth to power. And jurisdiction and funding responsibility is overlapping and unclear. For strengths, the program is backed by a solid base of evidence. The program is community-based and controlled. And the program aims at addressing often daunting social determinants of health, and similar programs have demonstrated that they can make meaningful legislative change. To finish off, I'd like to leave you with a quote from one of my key references. If we are seeking to fix community capacity in amber and then provide funders and agencies with its precise metrics, it should desist now. Such an approach risks more political harm than good to the processes of healthy, socially just, environmentally sustainable social change. These are my references, and thank you very much.